We're at the Ferezy Clinic in Windsor Heights, and Dr. Joe and I are about ready to talk about something that affects 80% of all people: headaches. Dr. Joe, it's so great to be here with you today, and I know we're going to be discussing something that plagues a lot of people: headaches. Do you see patients with headaches?
Oh, absolutely I do. And by the way, I've been warned about bringing too many slides, but I brought too many this time again anyway.
Well, knowledge is power, right?
Yeah. Well, headaches are a huge, huge problem. If you think about how many millions of people have headaches, it's one of the 10 most common presenting symptoms to primary care doctors. And if you think about all those people and how many days are lost from work, headaches cost society billions of dollars.
Sure. My kids seem to give me them a lot. What are some other causes of headaches?
Well, like I said to you before, when it comes to headaches, kids are sometimes, we call them carriers. But in fact, if you take a look at headaches, men have about 64% of all men will say that they had a headache within the last year, a severe headache, and 78%, almost 8 out of 10 women will. If you look at recurrent headaches, we're talking about numbers where men about 2 out of every 10 men, or 1 of every 5 men, and about 36% of women have recurrent headaches. So again, this is a huge problem.
What can we do to reduce this problem?
Well, first we look at the cause.
Okay.
The International Classification of Headache states that there's well over 100 different kinds of headaches. So, yeah, therefore, the therapies, there are thousands of different causes and different kinds of therapies. So what I'd like to do is stick to 2 real common headaches today, and then one that's less known but really popping up on the radar quite a bit, called rebound headaches.
Dr. Joe, every time I have a headache, I'm worried about having a brain tumor. Is there something to this?
Well, headache can be a cardinal sign of brain tumor, and what I'm going to do is talk about some warning signs of the serious causes of headaches in just a moment.
Okay.
But let me first assure you that brain tumor is a very uncommon cause of headache. In fact, if we were to take a look at a population of 100,000 people, and we said that 80% of them have headaches, only about 10 would be from brain tumors. So again, we have a very, very small percentage, but we should take a look at things that signal serious causes of headache. The first one would be the onset of a new, very severe headache. That's always worrisome, and when I say new, less than 6 months.
Can you tell me what would define a severe headache? I feel like I always have them, but maybe I don't. What's severe?
That's a good question.
What's severe?
Typically one that interferes with your ability to perform your functions during the day.
Okay.
That's what we call severe. People walk around with more minor or moderate headaches,
Sure.
but they still get the stuff done. But when we talk about severe headache, we're saying something that's going to interfere with your day. And if you're starting to get those kinds of headaches and you've had them less than 6 months, then that could be a warning sign. Another one would be headaches that start mild and just get progressively worse and worse and worse. Again, this 6-month window is where we really worry. If you've had these types of headaches for 5 or 10 years, it's probably not a very serious cause. Another one would be the onset of a headache after straining or coughing or working out. Those kinds can sometimes be problematic. Another one would be the presence of associated symptoms. So if you're having a headache and at the same time difficulty speaking, or you can't move your arm, or your legs go numb, that kind of thing, then of course that would be a scary sort of scenario,
Sure.
and that would lead you to think it might be a more severe headache. The final one I'll mention is having these severe headaches that onset after age 50. It's actually unusual for people to get these bad headaches later in life, and so if you do, that's something that should probably be checked out by your doctor.
Now, you've talked about the length of a headache, like if it's 6 months or 5 to 6 years, but how long should a headache last? Is a headache something constant, or should they go away after a half hour or 60 minutes?
That's a good question too, and it essentially depends on the type of headache.
Okay.
Migraines typically last a whole day. Sometimes they go more than that,
Okay.
Which is unfortunate, and some people have like what we call a migraine hangover. They actually have a day after the migraine where they feel that they just can't think straight. But tension type headaches usually start what we call episodic. You get a headache, it goes away. You get a headache, it goes away. But over a period of time, the headaches last longer, the relief is less complete, and eventually it could work itself into just wake up with a headache, go to bed with a headache. And that's very disconcerting to people.
Dr. Joe, you've given me a lot of knowledge about headaches. I know you mentioned migraines, so I bet we're going to be talking about that next.
Yes, we will.
Sounds good.
Thanks.
Stop in and see Dr. Joe, or for more information, give him a call or visit his website, ferezyclinic.com.